ISO Tech Medicine, Garching, Germany. Radioactive Pharmaceutical Production Laboratory. According to the data Franz had in hand, he had only 3 hours to produce the medication from the radioactive Lu-177 he had brought. After that, the finished drugs had to be transported to the hospital without any delay. This was because the amount of Lu-177 undergoing nuclear decay within the medication was continuously decreasing. If they were late, the level of radioactive radiation emitted by the prepared drugs would gradually diminish, significantly reducing their ability to destroy cancer cells. Franz looked once more at the prescription in his hand, just as he had the week before. Maria Cordula, age 5. Whole body metastasis. Maximum lutetium-177 amount. 50 milliliters, colloid. When he had first read these details on the prescription, he had been unable to stop himself from whispering, "Poor little girl." This was the first prescription he had encountered that did not specify the exact amount of Lu-177 to be used in the medication. Using the patient's data from the previous week, he had personally determined the required quantity of Lu-177. Leaving the heavy case he had slowly dragged behind him at the entrance of the laboratory, he immediately went to change his clothes. He put on the ultra-clean room garments and carefully disinfected the Lu-177 vial he removed from the case. Without wasting any time, he placed the vial into a special chamber where contaminated air was evacuated by vacuum. An air motor ran for several minutes. When a green light turned on, Franz carefully transferred the vial into the glove box. Using externally controlled robotic arms, he meticulously prepared little Maria's medication in this environment, purged of oxygen and all forms of contamination. The pale yellow colloid he produced was then transferred, again with the help of robotic arms, into a dark brown glass vial and placed inside a box made of lead plates. He carefully removed the heavy lead container through the glove box's airlock and loaded it into the medical transport vehicle. Then he set off quickly toward the hospital in the city center. When he arrived, an official responsible for receiving medications for patients undergoing special treatment was already waiting for Franz at the door. As soon as the drugs were delivered to the hospital, they were immediately handed over to the physician treating the patient. Professor Altendorf was not particularly hopeful about these newly developed experimental drugs that had been produced specifically for him. As a professor of history, particularly specializing in ancient Egypt and Anatolian civilizations, and holding a doctorate in archaeology, he was deeply curious about every new door science could open. Perhaps out of desperation, or perhaps because he was someone who had devoted his entire life to science, he had agreed to use these drugs as a voluntary patient in the trial process that had begun with selected participants from various countries around the world. Normally, the results of such experimental medications were not shown to patients. However, on the first day he was to receive the treatment, his doctor, one of his former students, placed a document in front of him containing data obtained from the patients.